Hello, I'm Dr. David Cotter, a board-certified dermatologist practicing in Las Vegas, Nevada. Today it's my pleasure to chat with you about Leqselvi, or duruxolitinib, a new JAK1, JAK2 inhibitor recently approved to treat alopecia areata. Leqselvi's got an interesting history. It was originally approved in July of 2024 based on two paired randomized double-blind placebo-controlled trials, and that was Thrive AA1 and Thrive AA2. In these studies, there were over 1,200 patients, all adults aged 18 to 65, that were studied with severe alopecia areata. And the primary endpoint in this study were the proportion of patients that achieved a SALT 20 or 80% regrowth in their hair at week 24. And these patients had pretty severe alopecia areata. On average, they had 13% of hair at baseline. So these are hardened patients, tough to treat cases. And there's an interesting history behind Leqselvi, which is the brand name, and it's been brought to market by Sun Pharma. But if you heard me say the generic name, duruxolitinib, if that sounds familiar to you, it's because you're familiar with ruxolitinib, which is a topical cream branded by Incyte under the name Opzelura to treat atopic dermatitis and vitiligo. The take home behind that is duruxolitinib is a different molecule. And the way that it's different is instead of having hydrogen atoms, it has deuterium atoms, which are heavy hydrogens. So it's a different molecule. It has different pharmacodynamics, different pharmacokinetics, which is why it's used differently. Thinking about the pharmacodynamics and pharmacokinetics of this drug, it's different than some of our other JAK inhibitors we have currently available. Duruxolitinib is actually dosed BID. So the dose for Leqselvi for alopecia areata is 8 milligrams PO BID, has a pretty quick half-life of about 4 hours. So if you think about that, within a day of missing your Leqselvi dose, nearly 90% or more is washed out of your system. So with that fast out, we would also assume it would have a fast on. And in fact, this medication does. One of the secondary endpoints in their Thrive AA1 and Thrive AA2 studies was looking at the proportion of patients that have that 80% regrowth of hair as early as week 8. And that was achieved in 3% of patients. While 3% may not sound like a lot, that's an extremely quick endpoint for something like hair regrowth. So when I think about where this drug may fill an unmet need for our patients with alopecia areata, I think about fast, I think about fast onset of action, I think about it working extremely quick, and also having a pretty robust rate of regrowth at week 24 and about 30% of the patients achieving a SALT 20. In fact, when you look at network meta-analyses, which is the best that we have to kind of do cross-trial comparisons, it looks like Leqselvi is going to be the most effective oral JAK inhibitor we have for alopecia areata at currently approved FDA doses. Now, certainly you can play games and you can dose other medicines higher, but with what we have that's available in the United States, approved by the FDA at the current dosing, it looks like Leqselvi is going to be your best bet for your patients who want rapid and robust hair regrowth in the setting of alopecia areata. Now, there's a couple things that makes Leqselvi different other than just the BID dosing. This drug is metabolized by a special cytochrome P450, CYP2C9. What you need to know regarding that for your patients is that we actually have to check the CYP2C9 genotype when we start the medication. If there's any dermatologists out there that remember prescribing azathioprine back in the day, we had to check a TPMT genotype, and based on the patient's ability to metabolize azathioprine, we had to adjust the dose. Well, with Leqselvi, it's a little different. There's no dose adjustment, but after you check the CYP2C9 genotype, if the patient is a extremely low metabolizer, that'd be someone that you should not put on Leqselvi. The good news is Sun is paying for this genotype. It's something very simple to add on to your baseline labs, which are checking for JAK inhibitors anyway. So it shouldn't delay the start of this medication. It shouldn't really complicate things. It's just something to add on to your JAK start panel for your baseline blood work for your patients who are considering Leqselvi. In addition, if someone's on a strong CYP2C9 inhibitor, then you might need to monitor them a little more closely, and maybe they wouldn't go on this medication. That was my least favorite thing in medical school, is memorizing long lists of drugs that affect cytochrome P450 enzymes. So I just run an interaction check if I'm going to start this medicine. But to give you an example, there aren't too many medications we're encountering in the dermatology world that are CYP2C9 inhibitors, with the exception of fluconazole. I mean, other things are like amiodarone, and I don't have a lot of patients that are on amio these days, particularly my alopecia areata folks. But I'd encourage you just run an interaction check to be extra safe before you write this medication. Thinking about safety, that's so important, especially when we have multiple different options to treat alopecia areata these days. Certainly, this is a JAK inhibitor. It comes with the normal boxed warnings and monitoring recommendations for JAK inhibitors. And while those are the side effects that certainly we want to avoid at all costs for our patients, fortunately, they're extremely rare, just like all other JAK inhibitors for alopecia areata. We just don't see high rates of scary things like mortality, MACE, malignancy, thromboembolism, and even zoster in patients on Leqselvi occurs in less than 1% of patients. The event rate per 100 patients years was less than 2 per 100 patient years. So overall, a very safe, very clean JAK inhibitor, particularly in the alopecia areata population. The most common AEs, though, the things that actually bother patients that we might encounter clinically are things that we see in clinical trials, headaches of around 12%, acne with this particular medication at rates of about 10%, nasopharyngitis around 8%, and CPK increases in about 5% of patients. But that's not something we even monitor in our clinic. It's outside of the JAK guidelines to even check for CPKs. So all in all, when I think about Leqselvi, I'm excited that we finally have it to treat our patients. It's a fantastic new option for our patients who want robust and rapid regrowth of their hair. Rapid, robust regrowth is what we're looking to see for our patients on Leqselvi. When you start it up, 8 milligrams POBID, fast on, fast off, because it has a short half-life, which is probably why we see such rapid results in clinical trials. And make sure you check your CYP2C9 genotype. If a patient is an extremely low metabolizer, they're not a candidate for Leqselvi. So reach for another JAK inhibitor.